Well, welcome back. So we were talking about our clinical view, and the first clinical view is detached retina. So I'll make this so you can see that. I found this figure off of, darn it, I went into Google Images, and I just want to make this bigger so you can see everything. There we go. Okay. Actually, I can do it that way, can't I? Duh. So this is what your eyeball looks like if you dissect it. And so this is a cow eyeball. You can see this thick, gooey material. This is called the vitreous humor. And this is the internal portion. We've taken the vitreous humor out, and now we can see the three layers. The outermost layer right here, this whitish looking structure here, is called the sclera. Outside of that is a bunch of fat. And then we have this choroid, this dark layer. And then the very inner layer here is called the retina. And I don't know if you can tell from this, but it's very thin. It's like a very super thin layer, and it actually can peel away from the back of the eye. It's only attached at the optic disc. That's the only place it's attached at. And actually that's one of the reasons why the optic disc is your blind spot, because where it's attached there are no rods or cones. So a detached retina occurs when the retina pulls away from the choroid. And this typically doesn't occur because of this beautiful fluid called vitreous humor, which is a clear fluid in living eyeballs. It does become more cloudy when they're dead as well as when they're preserved. But as we age, the fluid can become more liquidy, which makes it not as likely to hold the retina to the back of the eye. One of the functions of vitreous humor is to hold the retina to the back of the eye and to maintain the shape of the eyeball. So a detached retina occurs as mainly in older individuals, but also in individuals that get a severe blow to the head that can cause the vitreous humor to pull away very rapidly. In individuals that have diseases like diabetes, this is going to be more common. And the way they fix it is through a process known as pneumatic retinopexy. And right here is a video that we can click on. I'm not going to do it. It's about a 5 or 6 minute video if I remember correctly. We never watch the whole video usually in class. I watch a portion of it just to show what's going on. Basically, they're going to stick a needle in the eye, and they're going to put a bubble that will push the retina to the back of the eye, and then they can do whatever they have to do to fix the problem while they're holding that retina to the back of the eye. Macular degeneration is another clinical view, and this is actually one of the leading causes of blindness in the U.S. It's associated with age, typically, so age-related, but it also is more common in individuals that have high blood pressure or diabetes, but it can also be seen in individuals that have had damage to the eye by infections or severe trauma. And with macular degeneration, the patient actually loses sight in the region of the macula, so that middle or most clear point of vision is going to be damaged. The peripheral vision is going to be fine. There isn't any real great treatment for macular degeneration. There are two major types. The most common is called dry macular degeneration, or dry AMD. And with that form, really just trying to stay as healthy as possible, taking vitamins, getting the proper nutrients that you need is going to help. But there's no perfect treatment for this. The other form, wet AMD, there are some treatments, but it's not as common. And I don't know a lot about the treatments. I know that you can find the treatments. There are laser surgery and other things that you can do. For dry AMD, which is the more common form, it's going to affect 8 out of 10 individuals that get macular degeneration. So 80% of the individuals that do have macular degeneration have dry AMD, and there isn't really any treatment for that. So now let's talk about the lens. The lens is actually the structure that focuses the incoming light onto the retina. That's its job. It is a clear crystalline structure. In the cow eyeballs that we dissect, it will not look clear, but that's because those are dead eyes, and the eyeballs that we have are living because they're in our eyes, so they're living. And the cow eyeballs have been preserved, which our eyes are not. So the lens functions to allow light to move to the back of the eye. That's what it does. And the image that we see then is going to be focused on that macular region, allowing us to see a perfect image. When the lens is relaxed, the suspensory ligaments holding the ciliary muscles to the lens are not, the muscle is not contracting. That's going to be when the lens is allowing us to see far vision. So we can see far away. But the lens actually accommodates for near vision. So if we're looking at something like, if I'm looking at my phone trying to see what is on my phone for whatever reason, then I'm using near vision instead of far vision. And my lens will actually get more concave, so it's going, or convex, I'm sorry. It's going to round more, and the ciliary muscles contract, making the lens get more round. And so this is what I just talked about. Ciliary muscles are what control the lens. And these are the ciliary muscles. These are the suspensory ligaments holding the ciliary muscles to the lens. And when the lens, or when the ciliary muscles are relaxed, you're going to be able to see far away. When they're contracted, you're going to see close up. So we have two basic cavities of the eye. We have an anterior cavity between the cornea to the lens, and then we have a posterior cavity from the lens to the back of the eye, or the retina. The anterior cavity is bathed with a fluid called aqueous humor. Aqueous humor is produced by the ciliary processes. So we're constantly producing aqueous humor in the anterior cavity, and that aqueous humor nourishes the cornea as well as the lens, and also helps with the iris. The posterior cavity then has a different fluid, which I already mentioned once. It's called vitreous humor. So it's a jelly-like substance, and its function is to maintain the eyeball shape, but it also pushes the retina to the back of the eye. So it holds that retina in place so that we can see properly. A disorder associated with the eye that, or with the lens, I should say, not just the eye, but with the lenses themselves, is called cataracts. And cataracts are opacities that are found on the lens. So it looks like there's a structure causing the pupil to not work properly. But actually, that's the lens. You can't see the lens there because the lens is clear, but here's a cataract, and so you see this large structure. What the cataract does is it causes your vision to be very blurry wherever that cataract is located. And there's a video that shows cataract removal as well right here. I'll let you watch that video on your own. It's a very fascinating video. They hold the eye open. They actually peel the lens tissue, so they pull the cornea back, they peel the lens tissue, they basically break the lens completely up, and then they pop a new lens in to the eye. And then they put the cornea back over, and everything works perfectly. And it's a pain-free operation, so it's really cool. So there are some disorders associated with vision that most of us have heard of. So farsightedness is called hyperopia. Nearsightedness is called myopia. And so normal vision, or emmetropia, the light rays move through the cornea, through the pupil, hit the lens, and then they focus on some focal point, whatever we're looking at, right? And that image is focused right to that fovea centralis, so that we see perfect vision and we have a beautiful view of it. When we have farsightedness, that focal point is behind the retina. And so we have to pull the light rays forward so that it hits the retina. And so we use these convex lenses that allow us to pull the light rays forward. With myopia, or nearsightedness, the focal point hits before the retina. So we have to push those rays back further. So we use concave lenses to push the rays back. And astigmatism occurs when the lens is not curved perfectly. It's not a perfectly round structure. Most people have a very slight astigmatism, and it doesn't really cause problems, but a severe astigmatism can cause people to look very blurry. Here's an astigmatism card, and I do have what it should look like right there. So you can see a very nice, easy to look at card. Treatment for astigmatism, as well as farsightedness or nearsightedness, typically our glasses or contacts, or they can use LASIK surgery now. And LASIK is a very popular surgery. My husband had it done, and it worked wonders for him. The last eye disorder I'll talk about then is presbyopia. And presbyopia is age-related farsightedness. So you struggle to see things close up. You can see things far away a lot easier. And this is typically because the lens doesn't work as effectively. The muscles don't work as effectively. And so usually you get corrective lenses. A lot of people get bifocals at this point because maybe they're able to see far vision poorly in one area, and then they have to be able to see close up poor or better later on, stuff like that. So you have two different types of vision problems. So you get these bifocals to allow you to see both far away and close up. This usually hits people after the age of 40. I'm going to stop here because my video is almost done, and I'll finish up with vision and start hearing and equilibrium in our next video. Okay? Bye-bye.